Taking on Medicaid fraud, waste, and abuse in Ohio. Ahead on Face the State.
We got a big problem, and Ohio is an area that some of this problem has occurred in.
Dr. Oz weighs in on allegations of fraud in Ohio as Republicans in the legislature roll out a plan to fight it. And a Democrats' bill takes a different approach to save hundreds of millions of dollars. Also, dealing with data centers and tax revenue. Governor DeWine puts a pause on new tax exemption requests as a brand new State House committee meets for the first time. What's being done to get a grip on the growth of the complexes across the Buckeye State. Plus,
we want to be the most military-friendly state for active duty service members, but also the most veteran-friendly.
how Ohio is rolling out the red carpet for military members and veterans. An interview with the governor you'll see only on 10. Face the State starts now. Thanks for joining us for Face the State on this final day of May. I'm Doug Petcash. Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz addressed alleged Medicaid fraud in Ohio with Governor Mike DeWine during a visit to Dublin. This comes after reporting by the conservative media outlet The Daily Wire of alleged home health care fraud in Ohio. Dr. Oz said all states, including Ohio, need to have clearer guardrails around programs because if they don't, law enforcement can't go after the fraudsters. But he says he trusts the job Governor DeWine is doing.
We got a big problem. And Ohio is an area that some of this problem has occurred in.
CMS Administrator Dr. Mehmet Oz said that, referring to 38% of Medicaid spending on home health care in Ohio happening in Franklin County alone.
You know, that's 3 times more than you'd expect. Doesn't make any sense.
Oz says the Trump administration believes Ohio, as almost every state, can do a better job implementing guardrails around home health care.
We've got a massive issue nationwide. I only ask for one thing: partners. Governors that we can work together with, who believe there's an opportunity to make the system work better, who, make sure everyone works a little extra to catch these folks.
Governor DeWine recently signed an executive order addressing Medicaid fraud. It allows the State Department of Medicaid to implement emergency rules targeting providers at high risk for committing fraud. That includes requiring providers to revalidate enrollment more often. The state also placed a moratorium on new home health care providers.
So these are things that we're working with the federal government. We're going to continue to work directly with them and to, do everything that we can to stop any kind of fraud.
The governor also estimates the state saves about $600 million a year by keeping Ohioans out of nursing homes and instead allowing them to stay at home receiving home health care. On Wednesday, Republican leaders at the State House rolled out their anti-Medicaid fraud bill. State Representative Mike Davila unveiled the Ohio Medicaid Program Integrity and Fraud Prevention Act. The act would boost the electronic verification of in-home personal care services, require the State Department of Medicaid to conduct in-person inspections before approving any new providers, and increase the penalty for Medicaid fraud up to a first-degree felony depending on the amount of fraud committed. In a statement, Davila said Medicaid was created to serve the truly vulnerable, not to bankroll scammers, fake providers, and organized fraud rings that treat public assistance like an open checkbook. This effort is about restoring accountability, protecting honest Ohioans who are footing the bill, and making sure Medicaid dollars go to the people who actually qualify and truly need help. State Auditor Keith Faber testified before the House Medicaid Committee in support of House Bill 795.
Our message has been consistent. If taxpayers' dollars are stolen, wasted, or abused, or spent without proper oversight, we are going to find it, report it, and push for controls needed to stop it from happening again. That's why this bill matters.
Representative Davila says the bill also establishes guidance for state employee fraud reporting and enhances reporting mechanisms to the auditor and attorney general. A bill sponsored by a Democratic state representative takes a different approach to reforming the Medicaid system in Ohio. Back in March, before the allegations of Medicaid fraud came out, Democratic State Representative Karen Brownlee introduced the Medicaid Savings Act in the Ohio House. It had its first hearing May 19th in the House Medicaid Committee. The bill would basically restructure how the State Department of Medicaid administers Medicaid for patients. Brownlee says the bill could save the state $1 billion over 2 years by cutting waste and redundancies. I interviewed her a few days ago about how it would do that. What do you make of allegations of Medicaid fraud in Ohio?
So the current allegations that we've been hearing about from the national level have not been substantiated. That's first and foremost. It is a large system. I am sure that waste, fraud, and abuse do occur at all levels. At what amounts at the varying levels, we really don't have a lot of insight. And that does lead me right into House Bill 780, which is the Medicaid Savings Act. We currently know that we've got a very large managed care organization operation that's administering Medicaid. So we started out with 5 managed care organizations, and we now are up to 7 of them. Those 7 companies administer Medicaid insurance to the 3 million Ohioans who use it. And with 7 different administrators, that's 7 different redundancies of administrative cost. And the way that the system is managed, they're really not required to be very transparent. So we don't have a great indication of the accuracy of the medical loss ratio. That medical loss ratio is the amount of money that the companies are spending, managed care organizations are spending on administration and quality assurance product versus actual health care. What we think it is about right now is about 12% of all of the healthcare costs going into Medicaid are going towards administrative costs right now.
And your bill would switch to an administrative services organization model. What's the difference?
So the difference is that this administrative services only organization would be a single payer program. It would be one line of payment and management and oversight. So it would simplify the processes immeasurably. Not only would it simplify, but it would have different standards of oversight. And so we would have a much clearer picture of what the data on outcomes, health outcomes was, what the data on administrative costs are, and what the outcomes on how much they're actually investing into Ohioans' healthcare versus administrative or overhead costs. Connecticut has moved to this model. They moved on to it about 10 years ago. They have saved $4 billion in Medicaid management while also increasing the number of providers that work under Medicaid and improving health outcomes.
So how would it save $1 billion estimated over 2 years?
So we are still waiting for the fiscal note on this. It's a very complex amount of math that needs to be done. But early estimates are that by reducing the redundancy of the Medicaid managers and administrators, we would be saving between $400 and $850 million a year. Now, that is a real significant amount of money. Even if we are having provider fraud, even if we are having patient fraud, there is no possible way that any individual could be committing fraud on the waste scale from $400 to $800 million a year.
So this bill really focuses in on the waste part of the fraud, waste, and abuse, right?
Correct. I am not accusing any of the MCOs for fraud or abuse in any way, shape, or form. I am simply pointing out the fact that we have 7 managed care organizations that are all charging for the same administrative types of costs across the board 7 different times. And that administrative overhead cost is taking dollars away from actual health care.
An identical companion bill is in the state Senate. It has also had a first hearing. Senate Bill 386 does have a Democrat and Republican sponsor. Data centers also got a lot of attention this past week. Governor DeWine announced that he directed the Ohio Tax Credit Authority to pause consideration of any new data center tax exemption requests. This comes after a recent report by Signal Ohio that showed sales tax exemptions for data centers cost Ohio about $1.4 billion more than the Department of Taxation forecasted for 2025. 10 TV has independently confirmed this data. Governor DeWine says the pause on requests will stay in effect while a joint committee of lawmakers looks at the growth of data centers in the state. That committee held its first meeting Wednesday. The governor stresses this is not a ban on data centers. The pause on requests will take effect after Monday's Tax Credit Authority meeting. After the governor's announcement, Democratic State Representative Tristan Rader introduced a bill to repeal the data center sales tax exemption. It is companion legislation to a bipartisan bill in the Ohio Senate. Coming up next on Face the State.
We have a large number of veterans, obviously, in Ohio. We welcome more to come.
The governor's goal to make Ohio the most military-friendly state in the nation. A conversation you'll see only on 10 next. A large crowd of family, friends, and supporters gathered to honor a local hero this past Memorial Day. It was the first Memorial Day since Master Sergeant Tyler Simmons of Columbus died in a plane crash in Iraq in the early days of the Iran War. Simmons was a boom operator on KC-135 jets with the 121st Air Refueling Wing at Rickenbacker Air National Guard Base. He and 5 others were killed while serving in support of Operation Epic Fury. Now, his name is being added to the War Memorial at Linden Park in Columbus. We were there for the ceremony.
We had hoped to never have to add a name to the War Memorial, but tragically, that is not the case.
The name Tyler Simmons will soon take its place of honor on this wall after his death serving his country at the age of 28.
This is overwhelming in a positive way to have Tyler being remembered like this.
Tyler's father, Milo, says he is very proud of his son because of his service and because he followed his dreams.
He died doing what he loved doing, and so I'm okay with that.
A family feeling the pain of loss.
And your presence reminds us that behind every service member, there's also a family who serves and sacrifices.
Today, our commemoration is dedicated to Air Force Master Sergeant Tyler Simmons, whose life and service represents the best of our community and our country.
Major General John Harris says Tyler was really good at his job as a boom operator, refueling fighter jets going hundreds of miles per hour.
And I'm going to tell you, Tyler Simmons excelled at that, promoted to leadership positions in his unit faster than anybody had ever been promoted.
His family touched and buoyed by support from the community.
I'd rather have him here. I'd rather not be here doing this. Had it my way. But if it has to be, then we'll take it like this.
And Major Jennifer Green, remembering and honoring a man she says led with integrity, quiet determination, and an open heart.
We salute you, Tyler. Your duty was noble, your sacrifice profound, and your memory forever a part of us. Rest easy, Airman. We got it from here.
Milo Simmons says he thinks of Tyler as a real American hero, and that is G.I. Joe's slogan. He thinks it would be great to have a Master Sergeant Tyler Simmons boom operator G.I. Joe because there isn't one of those yet. 2 other members of the Ohio Air National Guard were killed in the refueling crash. The 121st Air Refueling Wing remembers Captain Curtis Angst of Wilmington, Ohio, as a strong pilot and leader. He leaves behind a wife. Captain Seth Koval is remembered as one of the wing's best and brightest KC-135 instructor pilots. He leaves behind a wife and son. And this brings us to a conversation 10 TV's Station Aken recently had with Governor Mike DeWine about Ohio's commitment to veterans, military members, and their families. The Buckeye State is home to nearly 700,000 veterans, 32,000 military personnel, and more than 16,000 military-connected students. Governor DeWine says Ohio is all in for the military. He plans to make sure our state continues to expand efforts to support veterans, active duty personnel, and military families, even as his time as governor winds down. Stacia has this interview you'll see only on 10.
You have a very special and unique goal that you are aiming for Ohio to be the #1 most military-friendly state in the nation. Tell me more about that goal.
You know, we want to be the most military-friendly state for active duty service members, but also the most veteran-friendly state. We have a large number of veterans, obviously, in Ohio. We welcome more to come. And then, you know, if you look at all the service members we have, look at Wright-Patterson Air Force Base with civilian employees as well as the military. There's 38,000 people go into that one site every single day, and we've got, you know, guard bases all over Ohio. So we're a state that has historically had a great commitment to the military. If you look even back to the Civil War, we sent more people per capita than any other state did. So we're all in for our military. And, you know, they face unique challenges. They are moved around, you know, with all the ramifications of that. So when I became governor, you know, we were talking to people in the military, and one of the things that they talked about was that spouses who also go along with the military member, they might have a profession too. They might have a career too. And in all likelihood they do. And then sometimes, you know, if it's a teacher, the license doesn't transfer, or if it's someone with a technical skill, maybe that does not transfer. So we've really worked on that to have more reciprocity between the states, and just to do things for that family, to recognize the special particular problems that they have. We have, for example, they bring children in to the state. We have open enrollment. You know, the school districts are required to allow open enrollment for those military children. The same way when they go off to college, we treat them as we should. We treat them as Ohio residents. We treat them as Ohio, even though their residence may technically be in Massachusetts or someplace else. So these are just things that, you know, we're able to do, we can do, and we certainly want to do.
What's the next thing on your list? Because you acknowledged there elements of support for the service member, for the spouse, for the child. What's next on your list to pursue this goal?
You know, we have, one of the things that we did when I became governor, I named 2 people to very important positions. Tammy Puff is our liaison with military families, particularly those who have lost someone, and those families, those Gold Star families. And she does a phenomenal job working with them. Also, Joe Z's, who has a long history in the military. Military is so important, our bases are so important to us in Ohio. I wanted someone at a cabinet level to advise me. And you know, Fran and I grew up in the Miami Valley. We're close to Wright-Patterson Air Force Base, but I wanted someone who really understood what was going on. And so that's been helpful for us from an economic point of view, but also I think gives us a better sense of what the concerns are of people in the military. So we're going to continue to listen to them. We're going to continue to listen to the members of our National Guard. You know, we have tens of thousands of people in the National Guard who serve they're available to serve every day. They're citizen soldiers, so they're maybe on their job, but then they get called out if we have a weather problem somewhere, or we have an ice storm in southern Ohio, or you know, or they may be deployed. We have hundreds of them who are deployed now along our southern border. We have over 400 who are deployed around the world right now. So we think of them, and we try to listen to them too.
In this next step, you're in your final months as governor of the state of Ohio, and someone else will come along and lead the state. How do you plan to assist in the transition of making this a priority in the next administration? Well,
I think that the next administration, I'm sure, will have this as a priority. It's just such a natural thing, I think, for Ohioans to do. But, there are a lot of traditions. We've had traditions with memorial services, and before Memorial Day, we always do a great service. And then Fran and I invite all the Gold Star families over to our house afterwards for lunch. And we'll let them know about those traditions, and I'm sure they'll want to carry those on.
There's a lot of patriotism here in this state. You can feel it everywhere you go. This effort, your goal, goes beyond patriotism. How can the community be a part of supporting our veterans, our military-connected families, in your goal of making this the #1 state for military families? How can everybody be a part?
I think we're a very welcoming state, and I think we are a state that tries to take care of each other. That was amply demonstrated. I had the opportunity to talk to 2 families just today who had a service member whose remains were never identified and just now identified from the Korean War. And what amazed them is when they had the service and they brought the remains back, people lined the streets, they lined the roads. Children were there with flags, and the family members remarked, we thought no one would ever remember our loved one 70-some years ago, but they are now remembering and really supporting the family. And that's really what it's about, is trying to do everything we can to support these military families, because they sacrifice a lot. The families sacrifice a lot, not just those who are deployed, not just those who serve, but their families who go with them. They have to be special people too. We need to support them.
Stacia joined local veterans on a recent Columbus Honor Flight as they saw the monuments and memorials built in their honor in Washington, D.C. You can watch Honor Flight, Reflections of Service and Sacrifice, now only on the free 10TV streaming app. Straight ahead on Face the State of Ohio is on a quest to improve the vision of our youngest students, and a program championed by Governor DeWine is about to get a whole lot bigger. Next, expanding Ohio C to make sure kids who need glasses get them. A program that's helping thousands of Ohio kids see more clearly is about to see a lot of growth itself. Right now, the Ohio Student Eye Exam Program, or Ohio C, is a pilot program in 15 counties, including Franklin. With another $25 million per year from the Federal Rural Health Transformation Fund, Governor DeWine says the program will go statewide next school year. Centers for Medicare and Medicaid Services Administrator Dr. Mehmet Oz joined Governor DeWine Tuesday for a special ceremony at Hopewell Elementary School in Dublin. 12 students there received free eyeglasses through the Ohio C program. Here's how it works. Mobile vision vans visit schools to give full eye exams to kids who don't have access to follow-up exams. Then, if they need glasses, they get them for free. Dr. Oz explains why he sees the program as critical.
You don't have to have vision to learn, obviously, but it makes it easier to learn if you have vision. And because 80% of your ability to take information in comes through your eyes, these kids have a difficult time. If they can't see the chalkboard, they also get bored. They get disruptive, they get frustrated.
This is a program that is very, very cost effective. It's a program that makes a phenomenal difference in children's lives.
This school year alone, the Ohio C program tested more than 10,000 kids in kindergarten through 3rd grade in those 15 counties. More than half needed glasses and got them for free. Now, even more kids all across the state will get help seeing more clearly next school year. Thank you for joining me this week for Face the State. I'm Doug Petcash. I'll see you back here next Sunday at 11:30. Have a great day and a great month of June.